Hi there, I'm Catherine from Can Physiotherapy. The menopause has over 40 symptoms ranging across the body, and I'm here to tell you about how physiotherapy can help with some of those symptoms. 1 in 3 women experience issues with their bladder at some point in their life, and this is increasingly common during the menopausal years. Stress incontinence, where you have a leak on exercise or sneezing or coughing. Urgency incontinence, where you just find you need to go all the time and often don't make it to the toilet. Or, on a simpler level, you're at the beginning of that process where you start to look for the toilet wherever you go, and you're often going for just in case wheeze and never fully filling the bladder for fear that you might leak. The bladder can also be painful and uncomfortable, or can prolapse because of a range of factors. Physiotherapy can really help with this. First of all, identifying what exactly the issue is, how often you're going, how much leakage there is, and narrowing it down to your specific problem for the individual. We fully assess the pelvic floor muscles, their strength, their tone, and any imbalance from one side to the other, because this is really common too, depending on what trauma the pelvis has been through in its life. We can teach you strength, we can teach you relaxation, we can teach you how to control your pelvic floor in those tricky situations where you just feel you're going to have to let go. Physiotherapy can also help with bowel issues, constipation becoming a big issue at the time of menopause. This can be hormonally induced, but nevertheless there are physical ways that we can alleviate the problem. From small lifestyle changes such as hydration, to physically using the muscles differently or positioning on the toilet to ease out the passage. Everybody is different, so we first of all find out what's happening exactly with you, how long this goes on for, what your techniques currently are, what strategies have you already tried, and giving you something new to do. Often constipation and even bowel prolapse can be resolved and managed with very simple lifestyle changes. Even though it feels it may be controlling your life just now, there are things that can improve. To get a diagnosis of a pelvic organ prolapse can be really scary, and it really can change people's lives. Often people aren't told exactly what grade of prolapse they've got, what type of prolapse, and are only offered surgery. There's lots and lots of things that we can do before you get to the stage of surgery in most cases. First of all, it's finding out exactly where you are now, what your symptoms are, how it's changing your life at the moment, and where you want to be, and what are your goals. Prolapse is often the result of a push or a pull factor. A pull factor potentially could be scar tissue, historically from childbirth or gynecological surgery, that's actually tightening and stiffening and pulling on the organs or tilting them in a certain way that manifests in bladder issues or bowel issues or pain. A push factor could be the way that you're doing exercise, the way that you're breathing, the way that you're moving, or compensation of the pelvic floor muscles for other muscles external to the body, such as the glutes or the lower back, that aren't also optimally functioning. Physiotherapy can really hunt down the root cause or the root factors, of which there may be a few, unpicking those and helping you in very simple ways to address them and improve them, and the prolapse then reduces, and certainly reduces its impact on your life. Finally, vaginal atrophy is something that's incredibly common and, again, feels very difficult to talk about. Although the first line of treatment is estrogen pessaries or estrogen cream directly onto the tissues, physiotherapy can again help. If the muscles of the pelvic floor are stiff or weak or too tight, and other ways not functioning to their best, then the blood flow to that area and to those tissues can get reduced. This means a reduction in delivery of oxygenated blood, a reduction in delivery of the hormones that you still are producing, and a reduction of removal of waste from those tissues. Physiotherapy can really help get the pelvic floor moving again by identifying where your weak spots are, where your stiff spots are, and what's holding on too tight. By increasing the movement in your pelvic floor, you can restore that blood flow, restore your natural hormone delivery, your natural oxygenated blood and nutrition delivery, to make the tissues nourished again, more functional, and therefore increase your natural production of fluids. This can improve issues such as dryness or pain during intercourse. More generally, as we all know, physiotherapy is great for getting moving. Joint pain, muscle stiffness and soreness are all big factors in many people for menopause. If you have an injury that just won't go away, if you're feeling like every day you're aching, then physiotherapy can really help with that. Again, assessing where your weak spots are, treating old injuries that have never really gone away, giving you techniques for mobility, simple ways you can fit in activity into your lifestyle. This is incredibly good for your mental well-being and will also improve sleep if that's a problem for you. I hope that's been helpful. Thank you so much for listening to me, and if you've got any more questions, you can contact me via my website or email at arcadia-therapy.com. I also have a YouTube channel with lots of interesting videos about the pelvic floor and how to get the best out of your exercises. My name's Catherine, Arcadia Physiotherapy. Thank you so much for listening.